Good morning. My name is Stephen Guffey, and I'm Associate Professor of Physical Therapy at Arkansas State University. I want to share with you today some new technology to treat common musculoskeletal problems. Our patient today is a young man who has suffered an acute strain of his upper trap and levator on the left. He presented to us shortly after this injury. He has a loss of rotation toward the side of the injury, has pain and difficulty, side bending away, has some loss of rotation in the opposite direction and forward bend, which lets us know that we have both the upper trap and the levator involved. We're going to be using a new product that's called the ThermoStim Pro. The ThermoStim has the ability to deliver either heat or cold through this probe surface. And if you notice, the surface is flat on some planes. It also has an edge in other planes which will allow us to mobilize soft tissue. In this case, since our injury is acute, we're not going to be doing much mobilization. We're more interested in controlling edema and pain. Therefore, we're going to be delivering cold. But we're also, at the same time, going to deliver electrical stim. We've included the patient in the circuit here. We'll deliver the stim through the ThermoStim probe. We're going to be delivering a biphasic waveform at 100 pulses per second with a pulse duration of 50 microseconds. We'll begin by covering the area just nice and smooth without a great deal of pressure here, since it is acute, with the flat surface on the ThermoStim probe. We're going to now introduce the E-stim, so we ask the patient to let us know when he can feel some of the stimulation. Okay? And then we will start the treatment there and begin to deliver by covering the body of the upper trap and including the levator. We'll deliver the treatment for about 10 to 15 minutes, making sure that we get the area really cold. Our goal here is to decrease the muscle tone that's been brought on by this acute injury, to limit any edema that occurs in the muscle, and then to control pain that's associated with the injury by using the cold and the electrical stim. It's a very comfortable treatment, quite relaxing, helps decrease the muscle tone a great deal. And we'll deliver this pretty regularly, once or twice daily for the first few days until we get on top of the acute stage. And as he progresses into the subacute and chronic phases of the injury, we'll be able then to deliver heat and use some soft tissue mobilization techniques with the same device.